if you were all listening to the last panel, they said that focus on the fundamentals. So how many of you believe that mental health is the fundamental thing that we need to focus on? Show of hands. Okay, a lot of people raising their hands. That's very good. How many of you think that generative AI can help with mental health and that's more important? Very less hands going up, and I totally get why you are thinking that. AI in healthcare, especially in mental health, is very fraught, right? We need to be very, very careful, and that's what we are going to be talking about. It's a topic that is very close to my heart. We are going to talk about what is the state of mental health in India right now, and what generative AI can do in detecting and helping with mental health. So, as of 2022, 1 in 7 people in India have had mental health concerns. And that number is only increasing. In a research that was conducted comparing year-on-year increase in stress levels, every single age group said that their stress levels have increased. And that is not surprising. Are these people actually getting the care that they need and deserve? No. There is a gap of 83%. 83% of people do not get the care they deserve. Why not? It's because due to socioeconomic backgrounds, people don't even realize that the symptoms that they are facing are related to mental health. If they don't even know that it is a mental health issue, how will they reach out for help, right? And that is where we need to bring generative AI. Our government is doing a lot in raising awareness. The national, state, and district mental health organizations, they are promoting this awareness. There are a lot more organizations these days that are providing in-person, online, and conversational talk therapies. And there are organizations such as Amaha and others that provide digital solutions. There are also generative AI-based solutions in India. They are Visa and Evolve. But there are a lot more generative AI-based solutions across the world. 2 of them are Wobot and Spring Health. They give generative AI-based therapeutic plans based on conversations that you have. The other one that is very close to my heart and I like is Kintsugi. Based on voice modulations, based on how I talk, it detects my mental health. We'll come back to that in a minute. And they are not the only ones. There are a lot more generative AI-based mental health applications worldwide. You'll see that I have put MindStrong front and center here. MindStrong claimed that based on mobile application usage, they can detect your mental health. And everybody loved this idea. They were given $160 million in funding. They closed down last year. You know why they closed down? Because their AI model was too complicated. The data that they were collecting was not ethical, and there was no psychological research proof backing that this can happen. That is why they closed down. And this is not just for them. All the other applications that you saw also have some feedback. People say that they install the app. Initially, in the honeymoon period, they use it a lot. After that, they forget about it. And they also say that the severity of the concerns are sometimes missed, leading to life-threatening situations. When the applications or solutions were free for use, they were happy to use it. When there was a cost involved, they don't want to do it, or they couldn't do it because of the cost effectiveness. And most of these solutions, even Visa, which was developed in India, uses data from other developed organizations. There is no solution that has Indian cultural background or have Indian language support. And last and most important is that if they continue to use just the solution, digital solution, there is an over-reliance on that. There has to be a counselor in the group. And so I have just been listing all the problems of generative AI solutions. So does that mean that we cannot use generative AI for mental health? No. What I am saying is we need to learn from all of this. There is a huge potential, especially in terms of identifying mental health problems. And that is the first step. And there is a lot generative AI can do in this regard. We can arm this as assessment tool for therapists, counselors, in schools, in hospitals, and at workplaces. So I'm not going to be talking about all of these use cases. I will run out of time and they will just kick me out of here. But I'm only going to pick up workplace as a use case to talk about and how we can identify mental health issues over there. Okay? Why am I talking about workplace in particular? Research suggests that 62% of us are severely stressed or burnt out at work. And only 33% of us feel that we have the right time and energy at workplace. And that is not surprising. A lot of us work for more than 49 hours per week. Raise your hands if you're working more than 49 hours per week. And we are asked to work even 70 hours per week sometimes, right? And most of these times are going in meetings. So for better or for worse, 70% of us say that we would rather talk to a bot than talking to our managers or colleagues. And that is where generative AI solutions can come in and help you. So while I was preparing for this session, right, I was working long hours because I was preparing for this session, more than normal. When I had conversations with my work colleagues, my voice was much more nervous, especially when I was talking about this conference. There is so much emotion and feelings that go into our chat, voice, video calls. We can track that using generative AI, and that can give a mental map of what we are feeling and how we are feeling. This is not new technology. Apple has already launched State of Mind. If you have an Apple Watch, I was speaking to a person here about that, they are already doing that. I will be okay at workplace to use such an application only if I was sure that the data that is being collected is not being sent to my HRs or managers, and it's mine alone. That's when I will use that. Yes, you can send aggregated data back to HRs and leaders. They can know the stress levels of the entire organization. They can be suggested, the generative AI solution can suggest solutions for process changes that will reduce the mental health concerns. It can also suggest training needs or hotspots for certain teams. Imagine the possibility if we are able to catch the mental health concerns right at that level, at that time, right? Because I'm running out of time, I'm going to quickly go through this. If we are going to roll out such a solution, we need to make sure that the data privacy is taken care of. The research is supporting psychologically, and the data quality contains a wide variety of data. And there are regulatory standards that are mandated. Hallucinations, people are going to talk about it. There has to be a counselor in loop so that the hallucinations and bias are taken care of. And we need to keep an eye on long-term efficacy. Okay?